Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. There are legal protections in place for people who use drugs to ensure they get the health care they need, but many still face discrimination and stigma. Today, I speak with Rebecca Jobe, Senior Staff Attorney at the Legal Action Center, about her work around litigation and advocacy efforts to combat substance use disorder-based discrimination, and the details of a major lawsuit LAC has brought against a hospital system. Let's listen. Rebecca Jobe, thank you so much for joining us. Tell us about the Legal Action Center and the kind of work that you do there.
Thanks for having me. The Legal Action Center is a law and policy organization that represents and advocates for people who use drugs or have substance use disorders, people living with HIV, as well as people with arrest and conviction records. I work on our legal team where we provide free legal services in New York for our constituents. And I focus really just on one part of LAC's work, and that is our efforts to stop discrimination against people who use drugs. Several years, even decades, LAC has been working to build health equity and address the overdose crisis and inequities for people with substance use disorders, with particular focus in the last several years on expanding access to evidence-based care to treat opioid use disorder, so methadone, buprenorphine, et cetera. And so we work with people who are criminalized and face discrimination in all areas of life, like employment, in child custody, and people who are seeking healthcare. We represent people facing discrimination in all of these settings and are recently focusing some of our discrimination work, anti-discrimination work, more specifically on the healthcare system. So unfortunately, the healthcare system is not immune from being influenced by stigma toward past or current drug users, which can have fatal consequences. And because substance use disorder is such a stigmatized health condition, as are the medications used to treat it, healthcare providers frequently disregard the serious needs of people with substance use disorders and treat their conditions as the product of poor choices or as the product of bad moral character. And we think that intrinsic to ending the overdose crisis is ensuring that people who use drugs have access to healthcare for needs that are related or not related to drug use.
Tell us about protections that are in place for people who use drugs.
So I'll focus on the anti-discrimination protections since there might be other protections. We do work on enforcing privacy laws and also access to insurance, but I'll talk about some of the anti-discrimination protections that exist. So there are several laws that protect people with substance use disorders that include the Americans with Disabilities Act and the Rehabilitation Act of 1973. There's also an anti-discrimination protection in the Affordable Care Act. And some states, like New York, have human rights laws that also provide protections for people with disabilities. And these laws essentially all say that you can't treat people with disabilities differently than other people. And this includes people with substance use disorders. So substance use disorder is generally recognized as a disability. And so that means that people can't be discriminated against or poorly treated or treated in some different way or have less opportunities because they have a substance use disorder.
The Legal Action Center recently filed a very unique lawsuit. Tell us about that.
The plaintiff is Sean Landau, who lives with multiple chronic health care conditions, including diabetes and opioid use disorder. And the lawsuit alleges that on different occasions when Mr. Landau was admitted to the hospital seeking treatment of diabetic ulcers and related infections in his foot, he was discriminated against because of his opioid use disorder. And so the case is challenging two types of discriminatory policies, practices, and procedures by the defendant. So I'll give a little bit of background about each of those. So the first policy and practice that the case challenges is the denial of methadone to Mr. Landau while he was admitted to the hospital. So prior to his admissions, Mr. Landau had been receiving methadone for treatment of opioid use disorder at an OTP, or an opioid treatment program. But when he was admitted, he was not consistently or appropriately given this medication, despite his request for it and despite that it had been previously prescribed. Methadone is one form of medication for opioid use disorder, which is the only evidence-based form of treatment for OUD. Stigma in the healthcare system leads to less treatment with this standard of care medication. And so the denial forced Mr. Landau to experience withdrawal, which, in addition to being psychologically and physically painful, is really dangerous and can lead to return to use, and it can lead to potential overdose since people's tolerance has decreased when they're not using, and because of fentanyl and the drug supply. So it's extremely dangerous, and it's not in line with any clinical standards to stop people's methadone while they're in a hospital or anywhere else. And so the second practice and policy that the case challenges is the denial of home-based antibiotics via PICC lines or peripherally inserted central catheters to people with substance use disorder because of their history of substance use disorder. So for Mr. Landau, I mentioned that he had been admitted on several occasions for treatment of diabetic ulcers and infections in his foot. And so to treat these, he was prescribed long-term antibiotics, which would have been ideally administered at home via a PICC line. And then on one occasion, he actually did have the PICC line insertion completed at the hospital. But as he was waiting to be discharged and sitting on the edge of his bed, a discharge doctor came in, read that he had opioid use disorder, and raised an issue about the PICC line, at one point even saying, "I'm not losing my license over some junkie." And so why this is important in a more medical sense is that PICC lines allow for administration of long-term antibiotics in a patient's home, and it's a preferred method of antibiotic administration because it is preferable for the patient. It reduces burdens on them. They don't have to sit in the hospital or go to a skilled nursing facility or go to a clinic every day. And it also reduces burdens on the healthcare system. So the lawsuit alleges that Mr. Landau was denied this care option because of his history with opioid use disorder and the hospital's stigmatizing assumption that he would just inject drugs into the line, despite that Mr. Landau said that he had no intention of doing so. And the defendants ignore that Mr. Landau was in treatment with methadone, no longer using drugs. Best objective medical evidence does not support the denial of PICC lines to people with a history of opioid use disorder. So that's the kind of claims in a nutshell.
When do you expect to see an outcome from this case?
The case is still ongoing, so I think we're many months away from a potential outcome.
But still, just the fact that you brought it at all is it, like I said before, is a unique situation. Tell us why it's so unique.
Absolutely. So this is the first case that we're aware of that challenges a hospital's failure to provide medication for opioid use disorder. There are cases in other settings, but this is the first that we're aware of in a hospital setting. And it's also the first case that's challenging the common practice of denying PICC lines to people with a history of substance use disorder. And so this case is really trying to expose the stigma that surrounds people with substance use disorder, even within the healthcare system. And there's so much work going on to stop the overdose crisis, to ensure that people don't die. But then the same system that we're supposed to turn to for treatment too often doesn't actually treat people who use drugs as people with autonomy and dignity in need of healthcare. And so ensuring equitable access to healthcare is an important part of interrupting the overdose crisis, as well as our country's structures of racism and classism, so that we can ensure that people receive healthcare and the healthcare that they want.
So this takes place in a healthcare setting. Can you tell us about some of the other work that you're doing and maybe other spaces where people might need this protection and how you hope this case will build on these issues?
There is a lot of work going around the country that LIC is engaging in and that other organizations are engaging in to ensure that people have access to medication for opioid use disorder or otherwise are not discriminated against for having a substance use disorder or using drugs. And unfortunately, people experience discrimination is prohibited discrimination, but does still happen in many different settings and through many different systems, almost every system that you might encounter. So people often experience discrimination in the criminal legal system, within the family regulation system, from employers, and unfortunately the list goes on. And so this case is really an important part of making sure that people have continuous, uninterrupted access to life-saving treatment. And all of this work is about promoting health equity. And so going forward, I think we need to be even more expansive in our thinking, and we need to look at intersections with race and class. And there's been this shift with the rise of the opioid epidemic to recognizing substance use disorder as needing a health response rather than criminalization, but we still need to examine how that lens is impacted by race and class. And there's a long history of disparate treatment of people who use drugs depending on their race, social and economic status, and their drug of choice. And these disparities result in punitive outcomes for Black people, for people who don't have a lot of money, and for people who are using certain drugs like crack and heroin. This case is an important step, but we have to go on beyond protecting just access to medication for opioid use disorder and really look at the larger forms of stigma that people are experiencing and how that is interacting with other forms of discrimination.
And the Legal Action Center is really approaching this on a variety of fronts. And so tell us, how can people get involved in your work?
There are so many ways to get involved, from small to large scale. And, you could get involved in Legal Action Center's work, and you could also kind of take Legal Action Center's model and our resources to advocate for people and to educate yourself. So I think one thing that's so important to do is to take the time to educate yourself and challenge stigma that is very pervasive. It can almost go undetected, but to really challenge those sort of accepted notions and realize that they're based in false narratives about people of color or about certain types of drugs. And then if you're a provider, you could always advocate for your patients. We have so many resources on our website that help with advocacy on our MOUD advocacy toolkit. But this is so important, and it can be very effective. The outcome that we want in all of these situations is for people to get the healthcare that they need. And so if a provider can advocate before healthcare is denied, that's almost ideal. It's less ideal for a legal solution, which takes a long time and is often after the fact and doesn't necessarily get people that healthcare. Sometimes it does, but I just want to stress that importance of providers as advocates. Lawyers can litigate these cases. They can write amicus briefs. They can also raise protections that the ADA and other laws provide if their clients are being discriminated against by a court, by a jail, when working, etc. The last thing I'll say is that individuals who are experiencing discrimination can contact Legal Action Center for help. And I'd say it's so hard to advocate for yourself, and it can be scary to object to treatment, and kind of an unknown path. Medical care is really difficult to navigate. But I think it's important that people do educate themselves and look for help to advocate for their rights, because their rights are there. People who use drugs do have rights, and they shouldn't be denied.
Well, Rebecca Job, thank you so much for being on Public Health On Call.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ciceri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.